All right, so let's dive into, well, this is a wild one, Donald Trump's latest cabinet pick.
This one's a doozy.
Yeah, so, I mean, everyone, listening, I'm sure you guys all know about the Kennedys.
The American political royalty, pretty much.
Exactly. So, well, Trump, back in the White House for round 2, he just nominated Robert F. Kennedy Jr. to head up the Department of Health and Human Services.
HHS.
Yeah, HHS.
Good one.
Huge. And what's so crazy about this, I think most people probably know this already, but RFK Jr., he's a big name in the anti-vaccine movement.
That's definitely causing some waves. Yeah, a lot of debate about this pick. And to really, kind of wrap our heads around what this might mean, I think it's important to think about just how much power the HHS actually has.
Right. Yeah.
We're talking a $2 trillion budget.
Trillion with a T.
Yeah. They're overseeing huge programs like Medicare and Medicaid, the Affordable Care Act, and they have a massive role in, dealing with any public health crisis.
Like COVID, I mean.
Exactly. Like COVID-19, the HHS was right at the center of the response.
Yeah. Okay. So huge EE responsibility. But what about RFK Jr. himself? Like, what's his deal? Besides the name, obviously.
Well, he's had, he's forged his own path, I guess you could say. He's a pretty well-known environmental lawyer, but I mean, it's his stance on vaccines that has really put him in the spotlight. He's a major figure in the anti-vaccine movement, to the point that he even founded his own anti-vaccine organization. So it's not just like an opinion for him, it's a core part of his, activism.
Right. Wow. Okay. So how did this announcement even happen?
Well, Trump never wanted to shy away from doing things a little differently. He revealed his pick on, his usual spots, Truth Social and X, what used to be Twitter. But what's interesting is the language he used when he did it. He specifically called out deception, misinformation, and disinformation in the food and drug industries. Mm-hmm. So it seems like maybe there's some common ground there with some of the concerns RFK Jr. has been, talking about for a long time.
That's really interesting, yeah. I'm sure that this news did not land quietly in Washington.
Oh, definitely not. The reactions have been, all over the place, I guess you could say. We've got someone like Senator Bill Cassidy, who's likely to be the chair of the Senate committee that oversees HHS. He's been cautiously optimistic. And that's a pretty important opinion because, that committee plays a major role in the whole confirmation process.
Right. Okay. So Cassidy's willing to, give him a shot. What's he seeing? What are the potential upsides he sees?
Well, he's pointed to a few things RFK Jr.'s advocated for, like healthy food, and more transparency in public health. Yeah. He seems to think that, RFK Jr. could bring kind of a fresh perspective to the department.
Okay, interesting. But are all the senators on the same page here?
Oh, not at all. Senator Ron Wyden, he heads up the Senate Finance Committee, which is a pretty powerful committee. He's expressed some serious concerns.
Like what? What's he worried about?
Well, his main thing is about, RFK Jr.'s stance on, what he sees as, basic scientific facts, particularly when it comes to, the safety of children. So he's pretty uneasy about the impact this could have on public health policy.
Sounds like this confirmation process is going to be, a bit of a roller coaster.
Oh, yeah, for sure. And to really understand what's at stake here, I think we need to kind of zoom in a bit on how the HHS actually works.
Okay, yeah.
Because it's not just like one giant thing. It's actually made up of all these different agencies, each with their own specific focus.
Okay.
So it's like this big machine with all these moving parts.
Gotcha. So RFK Jr. wouldn't just be calling all the shots, right?
Oh, definitely not. He'd be overseeing this whole network of agencies, each with, their own leadership and, their own way of doing things, their own culture. And I mean, let's be real, a lot of bureaucracy.
Right.
You've got the Food and Drug Administration, the FDA, which everybody knows, from food labels and drug approvals. Then there's the Centers for Disease Control and Prevention, the CDC, which, we all know how important they were during COVID.
Yeah, for sure. And then there's the National Institutes of Health, the NIH, which funds a ton of medical research, right?
Exactly, yeah. So even with all the authority that comes with being HHS secretary, right, RFK Jr. would be walking into this really complex web of existing systems and power structures.
Yeah, wow.
It makes you wonder, how much he could really change, even if he wanted to.
That's a great point, yeah.
Yeah.
It's not as simple as him just coming in and doing whatever he wants. But we can't forget about the anti-vaccine movement itself, which has been, kind of gaining steam in recent years. And this appointment is definitely putting it under the microscope.
Right. And it's important to remember, the movement isn't one big unified thing. there are all sorts of people with different views and different reasons for being a part of it.
Right. I can see that. Yeah. Some people might genuinely be, worried about the safety of vaccines or, side effects. Others might just not trust the government or big pharma.
Exactly. And, some people might just be getting their information from sources that, well, aren't really known for their accuracy.
Yeah.
It's a really complicated issue, and it just doesn't make sense to lump everyone together.
Right. Yeah. Okay. So, how do you think this appointment might affect the anti-vaccine movement, like internally? Do you think it might embolden them, or will some people distance themselves?
Yeah, I mean, that's the million-dollar question. Really tough to say for sure. It could definitely energize some parts of the movement, while at the same time, others might see his views, or at least some of his more, extreme views, as just a bit too much.
Right. And we can't forget, it's not just about vaccines with RFK Jr. He's got some other pretty controversial opinions too, right?
Yeah, his skepticism goes beyond vaccines for sure. He's questioned the safety of fluoride in drinking water.
Right, which is something that, a lot of public health experts are strongly in favor of.
Right, exactly. It really raises the question, how do we balance someone's personal opinions with, what the scientific community generally agrees on?
Yeah, that's a tough one. Especially these days, it's so hard to tell what's true and what's not with social media and, information coming at you from all sides.
Totally. And this is what makes this whole thing so interesting. We're not just talking about his personal beliefs. We're talking about how those beliefs could potentially affect an entire department, a department with a massive budget and a huge reach.
Right, nationwide impact.
Exactly, nationwide impact.
Yeah.
We're talking about potential changes to everything, from vaccine mandates to drug approvals to environmental regulations.
Wow, okay.
And it's not just about policies either. We also have to think about what this means for the Democratic Party.
Which is his own party.
Exactly,
Yeah.
his own party. This is a move by Trump that could really, cause even more division in a political landscape that's already pretty divided, especially with all the opposition from key Democratic senators.
Man, this whole thing feels like it could blow up at any moment. And I mean, this is just the start, right? We're just scratching the surface here.
Yeah, definitely. We've laid the groundwork, but there's a lot more to unpack here. To really understand what this nomination could mean, we need to dig into what RFK Jr.'s actual policy goals are, what his strategies might be, and, look back at how things have played out with similar HHS appointments in the past.
Right. This is a story that's definitely going to keep developing, and it could really affect all of us in some way.
Absolutely, it could. We got a lot more ground to cover, so buckle up.
Yeah.
Let's keep going. So, to kind of get a sense of what RFK Jr. might actually try to do if he gets confirmed, I think it's helpful to, look back at some of the stuff he said and wrote in the past.
Yeah, good point. What can we learn from his track record?
Well, one thing he's always been really big on is more transparency when it comes to vaccine research and development.
Yeah. I mean, that sounds pretty reasonable on the surface, right? Who doesn't want more transparency?
Right, exactly. It does have a kind of common sense appeal to it. But you have to remember, there are already all these, super strict safety protocols in place for vaccines.
Right, yeah.
And these protocols, they're based on, years and years of scientific research and testing.
So are you saying that these calls for transparency could actually be a way to make people doubt those safety protocols, even though there's not really any evidence that anything is wrong?
That's definitely a concern, yeah. It's a tactic that we see sometimes, where people try to sow doubt and confusion, even when there's no real basis for it.
It's a distraction, right? Trying to shift the focus away from the science.
Exactly, yeah. And it's not just about transparency either. RFK Jr. has also been pretty outspoken about his worries about, the influence of big pharma on public health policy.
Yeah, that's a big one. I think a lot of people are worried about that, how much power these companies have.
Yeah, and it's totally legit to be concerned about that for sure.
Okay.
But at the same time, we can't forget that these companies, they're also responsible for developing a lot of the drugs and treatments that, literally save lives.
Right. Yeah, it's about finding that balance, I guess, between making sure things are safe and, also letting them do their thing and innovate.
Exactly, finding that balance. And that's where RFK Jr.'s views on vaccines, really come into play, because he's not just, questioning the safety of a particular vaccine or, something like that. He's questioning the whole idea of vaccination as a public health measure.
Wow. Okay. That's pretty extreme when you consider all the evidence that shows how effective vaccines are.
It is, yeah. And if that viewpoint, actually became policy, it could have some really serious, negative consequences for public health.
Yeah, like what kind of consequences are we talking about?
Well, I mean, we could see outbreaks of diseases that we could totally prevent, increased healthcare costs, and even, sadly, people dying from things that we could have prevented.
Man, that's heavy.
It is. It really shows just how big of a deal this nomination is and, how it could potentially affect the health of, millions of people.
Okay, so are there any other areas where his views could, really shake things up at HHS?
Yeah, I mean, there are a few. For example, he's a big believer in alternative medicine and, using natural remedies.
Right, which a lot of people are into these days, I think, right? Like wanting a more holistic approach to healthcare.
Yeah, for sure. Alternative medicine can definitely be appealing to a lot of people. But it's super important to make a clear distinction between, medicine that's actually been proven to work and treatments that haven't really been tested or, might even be harmful.
So basically, promoting alternative medicine without, the science to back it up could actually be dangerous for people.
Yeah, that's a real risk. And it could also mean that resources are being, wasted on things that haven't been proven to be effective when they could be going towards treatments that we know work.
I feel like we're seeing a bit of a pattern here.
Yeah, you're picking up on it. It seems like RFK Jr. generally prefers a more hands-off approach to, regulating public health, like putting more emphasis on individual choice and freedom.
Right, which, I mean, in a society that values, individual liberty, that might sound pretty good to a lot of people.
It might, yeah. But when you're talking about public health, that kind of approach, it could actually weaken the very things that are supposed to protect, the health of entire communities.
Yeah. Like rolling back all the progress we've made in fighting diseases and, just generally trying to make people healthier, it's like going backwards.
It's definitely a possibility. And it's not just about vaccines and alternative medicine either. RFK Jr. has also said he's skeptical about GMOs, genetically modified foods. So that's another area where his views could kind of clash with what scientists generally agree on and maybe even affect food policies that the HHS oversees.
Okay, so it sounds like there are a lot of potential areas where his views could really rub the scientific and medical communities the wrong way.
Yeah, for sure. And it's not just about specific policies either. This whole thing, it brings up a bigger question about how we as a society deal with science and making decisions based on evidence. Especially now when there's so much misinformation and conspiracy theories floating around.
Yeah, that's a huge problem these days. It's like everyone's in their own little bubble, just listening to stuff that already agrees with what they think.
It's a worrying trend, yeah.
Yeah.
And it makes it really hard to have, productive conversations about these important issues.
That's like we're all speaking different languages almost. So how do we fix that? How do we even start to talk about these things when there's so much distrust and disagreement?
That's a great question. And I think it deserves its own whole deep dive.
Right.
There's no easy answer, but I think it starts with recognizing that, we all have our own biases.
Yeah.
And we need to be aware of those biases and, actually be willing to listen to people who have different views than us.
Yeah.
Even if we don't like what they're saying.
Yeah, that's so hard to do, though. It's like our natural instinct is to just shut down when someone's challenging our beliefs.
It is, yeah.
Yeah.
But if we want to, actually make progress, we have to be willing to have those tough conversations, even if it's uncomfortable.
It's about finding that common ground, even when we disagree about a lot of things.
Exactly. And we also have to be really careful about where we get our information from. We have to think critically and question anything that sounds, too good to be true or too scary to be real.
Yeah, which is way easier said than done these days. With social media, it's there's just so much information coming at you all the time. It's hard to know what to believe.
You're totally right. It's overwhelming.
Yeah.
But it's more important now than ever to be, really careful about what you're reading and watching.
Right. And we can't forget about holding our elected officials accountable too.
Yeah, absolutely.
We need to demand that they're making decisions based on, actual science, not just because of their political beliefs or because it's, politically convenient.
That's a key point, for sure. We have to be active citizens, make our voices heard and make sure our leaders are actually putting our well-being first.
Yeah, because at the end of the day, public health is something that affects all of us.
Right.
It's not about, Republicans versus Democrats or whatever. It's about keeping our communities healthy and, making sure future generations are healthy too.
Yeah. Couldn't have said it better myself. And that brings us to like the heart of this whole deep dive. You, as someone who's interested in this topic, you're probably wondering how this appointment might change things, not just within the HHS, but like within the whole world of public health in this country.
It's like dropping a stone in a pond, right?
Yeah.
The ripples just keep spreading out.
Perfect analogy. And the ripple effects of this appointment, they could be felt for years to come.
This is definitely a story that's just getting started, and it could really, touch all of our lives in some way.
Yeah, it really feels like we've just dipped our toes in the water here. There's the whole political side of it and the potential for actual policy changes and how people are going to react to all this.
Yeah, it's a lot to wrap your head around. And who knows what's actually going to happen.
But I do think it's useful to like zoom out a little and think about the history of all this. We've seen controversial HHS appointments before, and they often end up, being at the center of these bigger debates about, society and stuff.
Right. Yeah. It's not like this is the first time a president's picked someone who, has really strong opinions and wants to shake things up.
Definitely not.
Are there any examples from the past that like really stand out to you?
Well, one that comes to mind is Dr. Lewis Sullivan.
Okay.
President George H.W. Bush appointed him as HHS secretary back in 1989. He's, a really respected doctor, big advocate for public health. But he also had some pretty conservative views on certain social issues, like especially when it came to HIV/AIDS. So his time in office, you had some real progress in areas like childhood immunization, but also a lot of controversy about how he handled the AIDS epidemic.
Right. Yeah. It shows how these appointments can be like a microcosm of, the bigger cultural and political stuff that's happening at the time.
Exactly. Yeah. And with RFK Jr., I think his appointment really taps into this, growing distrust that we see of authority figures these days, especially when it comes to science and medicine.
It's like we're in this weird time where like everyone has access to tons of information, but it's harder than ever to figure out what's actually true.
Totally. And that's not going to go away anytime soon. But I do think there are things we can do, individually and as a society to like deal with all this information overload.
So like, what can we do? I'm sure our listeners want some like actual practical advice.
Well, one thing that I think is super important is media literacy. Like we need to be able to critically evaluate the information we see, especially, stuff online. So like, ask yourself, who's saying this? What's their motivation? What evidence do they have? Are they using sources that are actually credible?
Yeah, good point. It's so easy to just like read a headline or see something go viral and just like accept it without really thinking about it.
Yeah, totally. We need to develop that like healthy skepticism, that ability to think critically. And don't just rely on one source, look for information from different perspectives so you can get a more complete picture.
Right. So don't just stay in your echo chamber. Actually go out and see what other people are saying.
Exactly. And when it comes to science stuff, I always tell people to look for information from, those really reputable scientific organizations like the National Academies of Sciences, Engineering and Medicine, or the World Health Organization. Those groups are all about providing information that's actually based on evidence, not on some political agenda or ideology.
Right. Those are great resources. And I think it's also important to remember that, science is always changing.
Absolutely.
Like it's a process, we're constantly learning new things. So what we think is true today might be different tomorrow.
Yeah, exactly. Scientific knowledge is not set in stone. We need to be open to new information and be willing to change our minds when the evidence changes.
Right. Which means we need to like be humble, admit that we don't know everything and that like our understanding of how things work is always, subject to change.
Yeah, it's about being willing to learn and grow. Yeah.
Exactly. But that's what makes science so cool. It's like this never-ending adventure of discovery.
Totally. Yeah. As we go on this adventure, I think it's super important to keep having these like thoughtful, respectful conversations with each other.
Yeah, that's key.
Even if we disagree about stuff, we could at least try to understand where the other person is coming from.
Right. Finding that common ground, even amidst all the craziness.
Exactly. So as we wrap up this deep dive, what's like the main thing you want our listeners to take away from all this? What's that one piece of wisdom you want to leave them with?
Good question.
Well, for me, I think it's just about staying curious, staying informed and, staying involved. The world of public health, it's complicated and it's always changing and it affects all of us.
Yeah.
So by staying informed and engaged, we can all help to create a healthier future for ourselves and for everyone else.
That's a great message to end on. We've definitely covered a lot of ground today, starting with RFK Jr.'s background and some of his more controversial views to like what this appointment could actually mean for the HHS and for public health in general.
We've talked about the challenges of like sorting through all the information out there and why it's so important to think critically, be media literate, and, have respectful conversations with each other.
It's been a wild ride, that's for sure.
Definitely.
And it's definitely given us a lot to think about. But I think the most important thing is to just like keep asking questions, keep that curiosity alive, and never stop learning.
Couldn't agree more. The learning never stops.
Well, thanks for joining us on